So ayun, welcome back everyone to PT Meal Podcast, Live Handaan, a buffet of play, therapies, movement, exercises, activities, and leisure, all packed in hearty conversation of the physical therapy profession and practice with a Filipino flavor. Again, I'm Johan De La Paz, your host. So let's dig in. So for those who are first time watching the podcast, this podcast is available on your favorite podcast streaming apps in Spotify, Apple Podcasts, Google Podcasts, iHeartRadio, Amazon Music, and many more. You can also watch most of the full episodes in YouTube and also our live streams like this. And if you want to stay updated on fresh episodes, interview snippets, research abstracts, or educational materials, please follow the social media accounts of this podcast in Facebook, Instagram, LinkedIn. I think they're now X. They're not Twitter anymore, but X. So check out our Etsy store as well. Search PT Meal Shop at Etsy for some of the merch. All links and content are available in the website ptmealpodcast.com. All right. So as I've mentioned earlier, for today's episode, we are joined by board certified clinical specialists to talk about what the APTA Specialist Certification is. So the APTA provides opportunities for physical therapists to specialize on certain areas of the physical therapy practice. I think there are 10 specialties now. So let me introduce first our guest for today. They're not new to the podcast, but maybe new to live, except for one. All right, let me first introduce Dr. Ulysses Juntilla, board certified. Oh, there. Hi, Ayo. Board certified clinical specialist in orthopedic physical therapy, subspecializing on osteopractic physical therapy, and also certified in spinal manipulative therapy, spinal manipulative therapy. And he's also the resident director of the orthopedic physical therapy residency program in Columbia, VA, right?
Yes.
All right. Welcome back to the podcast, Yul.
Hey, Johan.
And
Thanks for having
and
me.
next one is a recent um, guest. Is Dr. Bobby Belarmino. He's a cardiopulmonary clinical specialist. He's also an assistant professor in UT Health in San Antonio. Bobby, welcome back to the podcast.
Thank you. Thank you. Thank you for having me again.
All right.
Appreciate this opportunity.
Hey, glad to have you back. And next, last but not the least, is uh, Phil Dumaligan. He is double board certified clinical specialist in geriatric and neurologic physical therapy. He works in an acute care setting in, oh, not anymore, in California. Welcome back, Phil.
Hi there.
Hi.
Thanks for having me back. I
Right.
now work at an outpatient neuro clinic for
Mhm.
Kaiser Permanente. I'm a clinical specialist here.
Got it. Got it. All right. So everyone here is a clinical specialist in different specialties. So there's a lot of questions first on what what is what the motivation of some physical therapists in getting that exam, because there's a lot of questions in, especially in our Facebook groups and physical therapy groups, on why should I get it, what's in it for me. And so I guess the first question for everyone is, why did you decide, or what convinced you to take the APTA specialist exam? In my experience, it's just that I was working in the geriatric field, so I thought it, might as well specialize on that. So, for you, what were your motivations? Um, Probably let's start with Phil. You want to start? Oh, sorry, you're muted.
Yes.
Yeah.
Okay, sorry. I was inspired by a physical therapist. He's in Florida now. I forgot his name. Sorry. Um, because he was in the ad for the board specialties for APT. I'm not too sure if the ad is still there, but
Mm-hmm.
he was double board certified in geriatric physical therapy and neurologic physical therapy, and he was Filipino, and I was like I'm still young, PT back then, and I was like, oh, this is a Filipino PT, and he's inspiring. I wanna try and specialize in geriatric physical therapy and neurologic physical therapy as well because Johan, that was the population that I was very much interested in.
Mm-hmm.
So after looking at the requirements and then after looking at the opportunities out there, I was like, I want to specialize. I want to do this and make sure that it's a lifelong learning for me. So that's
Mm-hmm.
why
Got it. Yul, do you want to share your story?
Yeah. I I realized one time working at the VA, we see a lot of musculoskeletal issues, and I realized that I have so much to learn. I have so much things to learn that I haven't learned from my prior training. Particularly, being a foreign-born therapist, there are so much things that we're missing. So one time I decided I'm gonna go for specialty, particularly in the field where I am currently, exposed, and then later on to a fellowship program as well. So that gives me almost like a professional or personal challenge for me to keep learning, as well as a professional development for me.
Mm-hmm. All right. Was it something that you planned before that you want to take,
I'm
or
sorry.
was it a planned move?
So it was not. I was not exposed to any of like specialties or any kind of special training. I know that there is a practice in ortho or be whatever uh, clinical path you want to take. But as far as taking into specific certifications for the career path, then that was not my intention.
Mm-hmm. All right. And how about you, Bobby? How was your experience? Why did you take the cardiovascular pulmonary specialist exam?
Yes, for me, I'm always interested in the cardiovascular and pulmonary section. So I started joining back then it was called the sections of the cardiovascular pulmonary, and I've been working, elbows to elbow with the big wigs in our sections, and I've seen them having a CCS. They enjoy the benefits of getting that certifications, and I've realized that this is something I'd like to do. Having seen the benefits to them and realizing that this is what I want to do, so I really focus my energy in what do I need to do so that I can accomplish this. And being joining the sections back then helps me the confidence, the informations, what I needed to do so that I can prepare myself better and be able to sit on the successfully for these clinical board specialization examinations.
Mhm. So you mentioned already benefit. Those that is one of the biggest question of our colleagues is what benefits would I get if I take this exam and be a specialist? And usually it's valid. It's a valid question, right? Would their practice change? Would their career change? In your experience, what did you gain, or what are the or what are the general benefits that you uh, enjoyed after becoming a clinical specialist? So, Yul, do you want to start?
Yeah, I thought that after gaining the specialty practice or being certified in ortho, you become a consultant to your colleague. That's one thing that I have noticed as an advantage. I have the opportunity to develop an awesome residency program, so that probably would not happen if I didn't pursue
Mm-hmm.
to the specialty practice.
Mm-hmm. Right. And Bobby mentioned benefits as well. Uh, what the benefits for you in your career and profession?
Yes, thank you. That's good questions. Benefits, external benefits and internal benefits. For the internal benefits, personal satisfaction, right?
Mm-hmm.
That I know that I achieved something greater, that I know that I be proud of this. External, that I can show that I have gained a special skills, and then I know that I can make a difference to my patients with this newly acquired clinical specialization training. I can make that difference. And also, my patients and my coworkers, let's put it this way, the third party stakers will know that they will receive a quality patient care from me, because now I have acquired this advanced skills, and I really tested on and really can show that I mastered these advanced skills. And also, because of that, all many doors open for me in academia. Particularly, I was back then. I don't have the CCS, but I was just an adjunct faculty in a local PT program, helping teaching the cardiopulmonary. Knowing that now I have a CCS, I have much more confidence. And then other programs start seeking me to teach in their program, and then started become a teaching the whole course. And then the next time I start receiving invitation from other programs to apply to their faculty position, because there's not much of cardiopulmonary faculty, and having a CCS is a very attractive qualifications. For my work, it did afforded me the opportunity to go to a next career ladder, because at that time we have this criteria that if you have a clinical specialization for APTA, you can apply for the next ladder, and that is called advanced clinician. So there's a little bit of an increase in salary, not much, but there's something. So yeah, there's those benefits.
Oh, okay. So it's not just in the academic, but also some clinical settings would have that benefits.
Yeah, at the end of the day, I know that I have mastered and advanced skills that my patients will be better. Because through that, I can assess, I can look at a different way than before. And then my patients, you can see the outcome of the patients. There was a study from APT, I can't remember exactly what was that, but somewhere that I read that if they compared patient outcomes from a clinical specialist versus non-clinical specialist, and they found that the patient's recovery is faster, basically better outcomes with someone with clinical specialization than those, because then it shows the benefit of that for the patient care.
Mhm. Before I let you answer, I just want to ask as well. Like uh, some colleagues might question that I've been in the field for a while, and I believe that I've providing the best care. And what would you say to those physical therapists who would say that I don't need that specialization exam, I don't need to be certified, I'm providing the best care to my patients, I've been here for a while and I know what I'm doing? How would you guys address that? I mean, that's valid. I mean, there's it's a choice to if you want to take the exam or not. But how do you usually talk to someone that with that kind of sentiment? Yeah, go Bobby.
So thank you. So I have worked with many therapists that are really good clinicians, and they don't, and for their own, personal belief, they don't need that certification. And I told them, good for you.
Hmm.
You don't, if you think you are providing the best quality care without really getting clinical specializations, and I said, more power to you. And and I respect that.
Hmm.
It boils down to, what do you want? What is your goal? How do you see your career moving forward? And if you don't see having clinical specialization as one of your, you know, plan, then be my guest. I'm more power and respect that, and peace be with you.
Do you want to
You
add
want to
anything
add
else?
anything else?
You'll.
You
Um, Almost like the
Mhm.
same thing as well. But it's a what Bobby has mentioned earlier. It's a personal gratification. It's a personal goal. It's a personal challenge. And as a lifelong learner, we try to commit into that uh, you know goal personally. And
Mhm.
then I learned before that someone told me before, don't be a prisoner of your own dogma, kind of thing. So it's very important that you're gonna open yourself.
Mhm.
There is a lot of possibilities out there and big things that we haven't learned yet. Me, I keep on learning every day, and I think so. uh, Again, good for them
Mhm.
or good for you.
So for me, when I was studying for the exam, I though I'm already in the geriatric space, I felt that I have to learn more about this because reading about more of the study guides on the specialist exam, I was like, oh, there's a lot of things that I can
Mhm.
still learn from just by studying this and taking the exam. So yeah, Phil, going to you, what was the benefits? What were the benefits that you've enjoyed after taking being a specialist?
Like Yul and Bobby, it did open a lot of doors for me, to be honest. Again, I'm foreign trained physical therapist. So if I apply in other jobs or, in academic medical center settings, I'm probably not going to be considered, just because of, I don't know, maybe where I was trained, um, they don't look at a Filipino therapist and say, okay, he's, this or he can do this. That's just my perception. I might be wrong. But because of my commitment, like Bavenil, to lifelong learning and showing them that, hey, I've been a clinical specialist for a while, I think that opened a lot of doors to be in those academic medical center settings. My current position right now with Kaiser Permanente is a clinical specialist. So one of the requirements is to have a board certification in the specialty practice that I am. So it did open this door for me. When the opportunity came, I was working in I think a fabulous setting, and I love acute care. But when this opportunity came, and it was neuro, I love neuro. I'm not gonna lie, I think it rejuvenated my career, my passion when I started seeing a lot of neuro patients. So I took this opportunity, and it's when you think about career ladder where I work, it's one of the highest career ladders in a clinician sense. It's not in the academia, but as a clinician, aside from being in an administrative position like a supervisor, it's one of the highest. So I'm very grateful um, of that opportunity, and I wouldn't be able to get this if I didn't have a board certification. So
Mhm.
just that. The other thing is making sure that you're involved in lifelong learning, because I really want to be the best for my patient. And you don't have to have a title or a credential to be the best, but it just demonstrates that commitment. So when we're seeing our patients and we're trying to provide them the best care, just having that credential doesn't mean I'll provide them the best. It's not automatic. I still need to prove, I still need to learn a lot. But that title will show them that, hey, this guy's doing this and he's going to be having that credential for 10 years. And for him to maintain that credential, he has to meet all these guidelines and requirements. So I think it would help the patients or their families or whoever build confidence that you can provide them the best care. There's people who will refer patients to me just because they looked up my name on the directory, and
Mm.
because I was the clinician close by, they're going to email me and say, hey, can you take this patient? So it does help in that regard. So there's a lot of benefits, and I hope that anybody listening who are interested in getting a specialty certification should consider that, because it does help with the referrals as well.
Oh wow! So the specialist directory does work because I just registered my name
Yes.
and I was like, oh, who would look for specialists in areas? And so it does work. Okay.
Actually, during COVID time, um, I got a lot of calls from the community because they saw my name for the cardiovascular pulmonary. So that is true. I was gonna tease Phil. He likes so much lifelong learning, so he doubled up clinical specialization.
True, true.
Yeah, I can attest on that too, Johan. I received some calls as well from the community as well,
Oh.
as being part of the clinical specialist group. Um, Unfortunately for me, I because my practice is focused within the Veterans Affairs, and I had not practiced privately nor in the community primarily. So, um, but it does work. It does work
Mhm.
with the list.
Uh-huh. So, as being a board certified clinical specialist is both an achievement as well as a reminder for lifelong learning. That that our profession keeps on evolving. There are a lot of information released every month or so, every year, so that we have to keep up with what we've learned or what is coming out now. That's a good one because some people would think of, what is this, the end game? Like, is being a specialist an end game? But it's not. It's the start of continuing more and learning more. Um, let's talk about the exam now. How did you prepare for the exam when you after you registered? There are two paths, right? Clinical hours and residency and fellowship. So how did you prepare for the exam? Let's start with Bobby.
Yes, so I think I'm the oldest in this group. So during that time, we don't have fellowship and residency. So the available resource that I have at that time is the sections of cardiovascular, descriptions of advanced practice and their review boards. So I used that. I took the descriptions of advanced specialty. I looked one by one and identified my weakness and my strength. And for those weakness, I find, what do I need to do to strengthen that? Do I need to go to books? Do I need to talk to people? And I really sought some clinical experiences. So I figured by that time, I'm very strong in cardiac, but I could improve a little bit in pulmonary. So I took a job uh, where I will really strengthen my pulmonary aspect, and I'm glad I did. And that even prepared me for the board exam successfully.
Mhm.
Yeah.
All right. Was that part of your plan originally, or just you just did that because you're going to that specialist track?
Right. So I, I was preparing for the board clinical certifications, and then the clinic descriptions identified these are my weakness. So I said to myself, there's no residency, there's no fellowship. All we have is books and going to continuing education. I can do that. What else? You still need to have some hands-on training. So I took also per diem job where I can enhance my pulmonary aspect, and that's why it afforded me to fill the gap that I need at that time.
Mhm. Good. Uh, Phil, how do you prepare for the exam?
I have to be honest, I'm not a good organized preparer. So when people ask me, especially before, people probably were driv I don't know, like, don't kill me, but I don't have like a formal preparation for the exam. But I know as a person that what I do is, if I see a diagnosis that I'm not familiar with, I'm actually going to research about it. I'm going to read about it. What's the current evidence? What's the clinical practice guidelines for this type of diagnosis? And that's how I practiced before.
Mm-hmm.
So I think that really, really helped me with both exams because most, I'm not too sure if I can say that, but most of the exams are, the questions are case-based. So, am I allowed to say this? This is published.
I think
Sorry.
same as NPT, that it's
Okay.
an understanding that it's mostly case based.
Okay. So that helps me a lot because I'm like, if you ask me trivia questions or um, I don't know, like some random questions, I can't answer you. But if you give me a case, it's it helps me process information and I can try and find the best answer available. So that helped me a lot with my preparation, but also like having the foundational knowledge, reading about the diagnoses, what are the interventions, what are the best practice about the diagnosis helped me a lot. Because once you're good with that, then I think it would help drive your mental process when you're doing the exams.
Gotcha. Self research. Bobby was did PRN jobs, and you self research on cases that you're unfamiliar with, and trying to expand on those cases that you haven't encountered in the clinics. And Hugh, how did you prepare for your specialist exam?
Um, Obviously, I didn't do residency program. I did the hours kind
Hmm.
of part. So um, prior to coming to the US, I was a faculty back in the Philippines. I was
Hmm.
teaching. So I have this when I was taking the NPT, I was also practicing clinically. So I um, or not practicing clinically, but I was teaching. So I have that almost like ability to jive two activities together. So when I came here and decided to take into the consideration for clinical specialty, I have to search or research more. Uh, what has really prompted me to or guided me with what I'm gonna do with like reviews and things to search was my experience in my transitional DPT. With that, I have learned that there is actually a GOSPT. there is a uh, there is a specific description of specialty practice that's published by APTA or
Hmm.
ABPTS for persons who are interested to be or for individuals who are interested to get into specialization. So they'll be guided on what to study
Hmm.
and what to specifically identify and even self test yourself what lacks in your current knowledge. So there is this description of specialty practice that you can actually take, and after that one, you reflect on which one is your let's say need development versus what you excels into, and that's what I took. And then after that one, just go on what has been recommended by my peers and colleagues who finished the the certification,
Hmm.
what kind of reviews that they took. I mainly do the APTA or ortho section published monographs. This is help, and then of course the ortho journals.
Mm. Did your certification in spinal manipulative therapist come after your specialist certification, or did it come first?
So that's a good question. I actually followed the career or development ladder for professional steps.
Hmm.
So after my DPT, I did the uh, certification for specialty, and then after that, I did my subspecialty. I did my fellowship. So after my certification in ortho, I have like decided I want to go into subspecialty in orthopedics, and that is spinal orthopedic mental PT. So I did finish a long year of fellowship in ortho OMPT,
Got it. So
which
now we're
I gained my fellow status.
awesome, awesome. So we're going into like the residency and the fellowship terms now. Let's that's the other route to becoming a specialist, or being eligible to take the specialist exam, is to go to the residency or fellowship route. Um, Bobby, you've started a fellowship program in one of your institutions before. Could you tell us about that, and then we'll also discuss the residency program that they have at VA.
All right, thank you. I'm gonna plug the postgraduate programs that I get help to develop at Houston Methodist Hospital in Houston, Texas. We have the only ICU fellowship in the nation, and then also we have the acute care residency program. With the new regulations right now, you have to have a completed a residency program first or clinical specialization first before you become a fellow. Before you can just, after our requirements, just 1 year in ICU, and then you can do a subspecialty in ICU fellowship. So yes, our ICU graduates, ICU fellow graduates are so successful that majority of them are now cardiopulmonary clinical specialists. The program that we developed centered that once they completed the fellowship program that they will be able to successfully pass the cardiovascular and pulmonary section. So there's that inherent expectations. We don't say that, we don't pressure them, we don't coerce them, but we try to tell them in their ears, after this, you already did all your hard work, might as well take your CCS, and they did. Majority of them passed that, yeah.
All right.
I have a
So-
question for Dr. Bobby.
Oh, yes, Dr. Phil.
Can you use the fellowship to to satisfy the requirements for the hours or residency hours for CCS? I feel like probably other people are curious about it.
If you have ICU fellowship for ICU, yes, because the requirement for the CCS is clinical hours in the taking care of the patients with cardiovascular and pulmonary disorders. And in our ICU, you're really going to take care of those individuals with cardiovascular pulmonary disorders because mostly they're in ICU vents. You've been in ICU. So yes, those fellows that are graduate, they use that clinical hours to meet the requirements to sit on the CCS board examinations.
I do have a follow-up question.
Yes, sir, Dr. Juntilla.
So, sir, what's this? As what Phil mentioned earlier, or asked earlier, does that satisfy? So, you also have an acute residency program. Are both routes for CCS in your?
No. The acute care is different. Acute care is for those who just completed their DPT and they want to for their training. So the way I look at it is that residency, acute care residency, you want to be like someone who is like hospitalist in the hospital. And then the IC. No. If you want to then take the residency, then take for the cardiovascular and pulmonary residency, and that allows you, qualify you to sit for the cardiovascular pulmonary. Right now, I'm not able. The Academy of Acute Care is trying their best. I'm part of that, trying our best to get a clinical specialization in acute care, which I believe they should be because in itself it's a specialty in itself. So hopefully the APTA, the ABPTS will support that and will allow additional clinical specialization for the acute care.
Gotcha. All right. Could you describe to us the residency program you had at VA for orthopedic physical therapy?
Yeah. So, along with my colleagues who developed this program, we developed this 2 years ago, and we have two residents, mainly in orthopedic physical therapy, following the description of specialty practice by ABPTRFE. And at the same time, hopefully, one of my goal for the program is later on to get into the subspecialty of OMPT for fellowship training.
Mhm. So with residencies and fellowships, all your effort and attention would be on that specific population or that specific specialization, and all of the patients that coming your way are curated, that you would encounter all of the requirements or
That's
cases.
Yeah, that's a good question because the uh, the board for orthopedic physical therapy actually, in order for our residents to satisfy the requirement,
Mhm.
is they have a list of medical conditions,
Mm.
which is probably the same true with other specialties. And then there are some medical conditions that are, for example, distal upper extremities, wherein majority of distal upper extremity cases are routed to occupational therapy. So for that, because our outpatient setting is already in an orthopedic musculoskeletal clinic, outpatient clinic, so we have varieties of orthopedic patients, musculoskeletal patients. But for those upper extremities, we have to um, tap our OT colleagues to triage some of our patients to exclusive for residency programs, so that our residents will have experience for those, like for like carpal tunnel or like finger surgeries, for instance, because we do see that a lot in physical therapy, but that's still part of the orthopedic specialty practice. And then another one is orthopedic pediatrics,
Oh,
wherein we don't
wow.
really see in ambulatory adult orthopedic PT. So in that cases, we also have to uh, uh, search some specific contracts with clinics who are exclusively seeing ortho pediatrics cases, so that our residents will be able to expose that, because that requirement, they need to at least experience or have manage those patients in order to satisfy the requirements or our requirements for our residents.
I didn't think about pediatric ortho. When I hear ortho, it
Yeah,
would I would think that it starts from teenagers and up. I didn't think that pediatric is part of it. That's amazing.
yeah.
So what would happen if you know somehow there's no case, a certain case in that program during in the duration of the program? Is there a plan B? Would you just go to like a case study or something, or
So
does that happen?
so there is a so our for all, but I cannot speak with all residency, but
Uh-huh.
in the program, when we do our accreditation primarily, there are we have the didactic portion other than the clinical practice, and then we also have learning experiences. So there are areas, let's say in orthopedic pediatrics, wherein the patient is not, or the resident is not able to see specific case, then learning experiences through journal, through research
Mhm.
can be used uh, to satisfy specific R's. But again, there is that specific R or time that we allocate for them to shadow or at least observe a PCS uh, clinician, so that they are considered to be mentors of the resident who are also board certified in pediatric PT.
Mm, got
Mhm.
it. Residencies and fellowships are, how long do they usually last? 1 year, 2 years?
It's a 12-month program.
Uh-huh. Okay. Um, One of the big questions as well going to residencies and fellowship, do they earn when they get accepted in those programs, or do they have like a stipend?
I can start. Yes. So they
Okay.
are in our program. They are we call it stipend, or it could be
Uh-huh.
salary.
Uh-huh.
Uh, in our case, we are about 60 to 70% from the entry level, like
That's
uh,
okay.
salary.
Hmm.
So it's a good, especially for new grads. So that's why a lot. As a matter of fact, um, it's very interesting because I have probably every time we open for a new cohort, I probably have two or three inquiries from uh, clinicians who have practiced for a while. Like
Uh-huh.
I wanna join the residency program because I wanna use that route to take the board exam.
Mm-hmm.
uh, so that I can learn more while I practice as well with men. Because the difference between the 200 hours, a 2,000 hour requirement, and the residency really is the uh, mentorship, that
Right.
number of hours of direct mentorship with as an experienced mentor. So the one that you're not gaining through the 2000, because that's self learning experience, uh, they want to be mentored.
Mm-hmm.
So when I tell them, remember, this is not like to carry over what you have, what you are currently earning, because this is a residency program, so you'll be receiving stipend, and a lot of them don't actually realize that it is that's the case. So that's why it is mostly appropriate for new grad who have just started their career, who wants to
Mm-hmm.
sit for the board exam after a year through a specific mentoring, or have satisfied mentoring status or experiences, and be able to sit for the board and then practice in specialty practice after.
Mm, got it. Is it the same case with the fellowship that you had there in Lobby? Stipends as well.
We, our resident and fellows, they are employee also.
Oh, okay.
Like yeah, where they receive benefits, medical benefits, tuition, all the things that a full-time employee will enjoy. The only difference, like Ulysses says, the salary, right? So I explained to them that you may be getting less money, but you're gaining a lot more because of the mentorship that you're going to get. I always hear from our graduates of residency that what they would gain for 1 year is something that another therapist would gain for 5 years. So, yes, you might not be earning as much, but you're getting back because of the amount of mentorship, the resources that will be allocated for our learner. We call it learner, so
Mm-hmm.
that they will gain that much knowledge and skills for 1 year. We had a fellow who had been practicing for 10 years in an ICU, two of them in the past. They really would like to learn the proper way, and we asked them, now that you finished this 1 year, would you do this again? And this individual says, yes, absolutely, because when you're working on your own, you tend to develop the bad habits, right? There's nobody there to going to coach you, critique you, and to show you the right way. With this direct mentorship, with this dedicated hours of mentorship, you develop the proper way, because we want to learn, we want to do the right way, and not, so you got that kind of training. So if you look at it in a way that yes, you might be earning less for this time, but the amount of knowledge that you're going to gain is something worthwhile as well.
Mm-hmm. So it's an investment.
Yes, it's a good investment.
Mm-hmm. And going into residency and fellowship, it's something that you would really think about in your career plan, because it's your focus on that. You're earning stipend, and you have your career path or plan should be clear, because it's not going to be it's serious, especially like if you have family and you're changing careers or something like that. Okay, well, that's a lot of factors to consider if someone is going into the specialist route, clinical specialist route, or going to take the exam. Either they um, go to the residency fellowship route or do the clinical hours. So for someone who is probably on the fence, trying to think about um, if they need or they want to take the specialist exam, what would you advise them to do or think about? Who wants to start first? Okay, Bobby, go.
say this to anyone who would like to take boarding clinical specializations or any other thing. I always start what my previous director had asked me, and after that, it's just like an eye opening. She asked me, "What is your short-term goals and long-term goals? How do you see yourself 5 years from now, 10 years from now?" So to answer your question for those individuals on the fence, whether they want to take the clinical specializations or not, is to ask themselves and make them self-assessment. Look at the mirror, look at themselves in the mirror and ask them, what are your short-term goals and long-term goals? How do you see yourself 5 years from now and 10 years from now? And if by any chance you don't see being a clinical specialist any point of that, then that's just not yours. You know, if for example you have been practicing, you have kids, you have family, you have bills and all those things, you can't afford to be a learner and then take a pay cut because you have people depending on you. Maybe you can do a traditional route of taking clinical hours and then do a self-education. There's so many ways to do that, and if you has the ability to, take a pay cut and go to the proper training, then do so. So it really depends on how do you see yourself 5 years from now, 10 years from now, and go for that.
Mm-hmm. All right. You want to go?
Yeah. So, as Bobby also mentioned earlier, I think it depends upon the audience who is asking that question. Um, if it is, because we have DPT students as well, I promote residencies. I promote continuing the path through residency program. After DPT, go to the next step before you start working, because when you start working, you can go back to residency, having those pay cuts. So while you are a student, go for the next, because the stipend, the salary that you receive is better than you are a student. So it's just another year of continuation.
Mm-hmm.
But if a colleague of mine who practiced for, like, let's say 10 years asked me about that question, like, I want to go for residency, I probably will say, I would prefer you to use the clinical hours if you have, practice in ortho. But if you're not in ortho and you're interested with ortho, you have to start practicing in ortho to gain that experience, clinical experience, and then probably just use like books, journals, and start like inquiring and research. So again, depends upon the audience, and for them asking that question, probably they have 50-50 interest, and then hopefully I can spark another 50% to get into the specialty practice and can convince them.
Mm-hmm. Right. So you're saying it's best for those who are newly grads to go right away to residency so that they don't feel the pay cut.
Yeah, and also after graduation, this novice practitioner, entry level practitioner, that's really the time that they need to develop. They need to be mentored. As a matter of fact,
Mhm.
I'm a big proponent of mentorship.
Mentorship.
If I had if I had to convey or to suggest changes in our Philippine, practice after graduation, I think everyone should have a mentor after they graduate, even though if it's not as a formalized residency program, they need to work under a mentor who are experienced in that specific field that they're choosing, because that's the time that you develop, as mentioned earlier, like bad habits versus a good habit in clinical practice.
Hmm. Right. Going to the Philippine practice, I think they have that already. Well, a plan for
Mhm.
specializations, right? Yeah, but that's a good one having the mentor right after graduating and like learning the paths or
Mhm.
areas of specialties where a physical therapist can go into. All right, Phil, your take on that. How would you you know advise a colleague who wants to or thinks about going into the special clinical specialist route?
I think same with Bobby. I think what you have to ask yourself, what are you gonna use it for? What is it for? I'm double certified, obviously,
Yeah.
so probably there was not a lot of reasoning there. I'm kidding. Um, there was a reason, but a lot of people ask me why, and
Mhm.
it is. I think I was lucky because I was lucky enough to know that neuro was my passion. I was actually seriously considering CCS, and I talked to to Bobby about that before. Um, but I realized like I'm already double certified with two specialties, and these are the patients that I interact every time, every day, right? So if I'm gonna go to another, if I'm like talking to myself, I'm going to another specialty, that means that I have to change my whole career trajectory and just focus on cardiac rehab. So um, if you're on the fence, make sure that this is what you want to do 10 years from now, because you're going to be interacting with a certain type of population, and you really have to enjoy working with this population. You really have to be passionate, because if you're not, then that's a lot of money they have to spend registering, and then obviously buying the resources that you need to be successful with exams. So make sure that you are really passionate with what you're doing before considering that pathway. But I still want to consider CCS in the future. No, I'm kidding.
Well, you can always get a third clinical specialization.
True.
You know, you have ICU experiences. Come on in. Just let me know, and you can be NCS, GCS, and CCS. You'll be the third only person who has that clinical specialization. Three.
But no kidding, I think like the guest over here, like whoever's listening, like Filipino therapist over here, like consider what Bobby says about the fellowship for ICU, because that's like Bobby, Belarmino, Christian Permi, these are like the big wigs in terms of ICU cardiovascular, um, the ICU Liberation Bundle. All of those, that's the source. So when I sought out mentors before, I worked at UCSF because of Heidi Engel. Not gonna lie. I always considered who are the pioneers, who are, you know, the people who aren't experts in this field, and I want to take mentorship from them, and that's like what I considered. And if you're thinking about CCS and you want to get that credential, if you want to apply, I'm plugging. I think you're going to get a lot of mentorship from the leaders in the field, and I think Yul will be the same because he has like one of the successful programs for ortho. So, who Filipino PTs? These are the people that you have to look up to.
Yeah. Fitting guests. All right. So that was really a fast discussion. We almost an hour already, but I've really gained a lot of insights from you guys and about s- the specialist certification, because there's a lot of still questions about it, and hopefully our discussion would help our colleagues and future colleagues on what path they want to take once they get here in the US. That's not just you can specialize on your own self study and stuff, but that this is also a good path for um, getting good at your um, chosen field or specialization. Uh, do you have any last? Yeah, go you.
Yes, just a follow up of for those who are interested. ABPTRFE or not ABPT, the ABPTS will start will have some major change
Oh,
by 2025 examination for those who are in the 2000-hour clinical hours route. So for those who are planning or contemplating to take or do the board certification, the deadline is in September. You can
mhm,
apply now for
mhm.
the March examination, because in 2025 the 2000 hours would not just be a pure 2000 that you have to give to them, but also they will start looking into the different cases. So there is a
Oh.
percentage now for, let's say, cervicothoracic. This is ortho, for instance, cervicothoracic. These percentage of patient that you have experienced,
Uh-huh.
lumbar spine or peripheral extremities, and this number of patients or percentage. So they have to look at that one because they want to really know that those individual who have or who will be taking the board exam are, have been able to experience the whole varieties of orthopedic cases or whatever their specialty cases they wanted to pursue. And
Mhm.
then the second one is for those who are already in the clinical practice and who wants to go farther in the field of ortho. You can always do the fellowship in orthopedic manual physical therapy. That's the next career ladder.
Mhm. That's amazing because um, when I was applying for GCS, I thought I have to list down all my patient cases, and I had to think about that. Go back, 2000, 2 years, and when I was applying, they didn't ask that, so
Yeah.
they didn't ask the cases. So they're about to do that now, huh?
Yes. Mhm.
Oh wow. Okay, that's a more tedious history of your patients. Yeah. So this year, the normal deadline is September, right?
So, mhm.
The early bird or early registration, the deadline is on July
July.
31st.
Mhm.
So I think CCS and other specialties have already finished the early registration, and the rest
Mhm.
still has that deadline on the 31st. Yes, Bobby.
Since we're talking for the preparations, for those who'd like to go to the, like Phil said, I mean, Ulysses, ABPTS, American Board of Physical Therapy Specialty, just Google that. For the for the cardiovascular clinical specialization, they do require a research requirement. You don't need to do a hardcore research. You can do a you can you the main important there is that you can satisfy that you did some form of research, that you perform, you've been part of the research process, so that you can check the box. So for that, you can just do a case study, you can participate to any kind of research, and then you can use that for that. So but that's one of the hiccups of the requirements that a lot of people ask us about. They want to do the CCS, but the research part is really the hiccup there. They thought they need to do a hardcore research, that they need to really do a random clinical design. No, you just have to have some form of research that you can really show that you have acquired that some form of knowledge and research.
So
Yeah.
case study would suffice.
Case study would be sufficient.
Okay, that's a different requirement. All right. So before we finish, let me ask some takeaway. Ano yung gusto natin pabaon to our audience? What do we want our audience to uh, take away or isharon sa ating conversation today or tonight, wherever they're listening from? You want to start, you?
Um, I think it's really like right now. Are you now decided to what's your next step in your professional career? So are you ready to go to the next step, or are you still contemplating about it? If you are ready, then I think this is the time. And if not this year, next year, go for it. And then you can have a lot of resources. Ask anybody who can be your mentor during that time or whom you wanted to learn from experiences or guiding you like through the process of applying and what to expect. There are a lot of colleagues out there, be Filipino colleagues or your local colleagues that who works with you in the clinic. They can be a great resources.
All right. Phil?
I think like as a Filipino physical therapist practicing here, as a foreign trained physical therapist, I think that we Filipinos have a lot to offer. I think we're excellent physical therapists. We're excellent in what we do, and we must show that excellence to inspire other people, like people who are probably in the Philippines or just starting out here in the US. It's one way for us to show our excellence by just satisfying the requirements by the ABPTS. So just showing that commitment to excellence is one way to inspire people. But whether you take the exam or not, I think you can show your excellence in your own way. But this is just one path to show the excellence. So just be excellent in whatever you do. I think that's my takeaway.
All right. Bobby?
Yung pabaon ko is wherever you are right now in your career, whether you think you're ready or not, or you're just starting to kind of pique your interest, I would suggest to start going to the American Board of Physical Therapy Specialty. Start there. Read as much as you can, and then identify if this is something you like. And if you do like it, then make a plan. Go to the academy and they'll provide you the necessary descriptions of advanced practice so you can identify your strengths and weakness. And then if you know your weakness and you're really sure that this is what you want to do, start improving. Like Phil said, do your excellence. And then at the end, whatever you do, you might decide not to pursue this or pursue it even more so. It's going to get you better. It's for the patients. You're going to provide more tools, more services, and at the end, you feel gratified that you're making an improved, a big difference because you know in your heart you did an excellent job because of the acquired skills, advanced trainings that you're going to develop over time.
All right. So there. So thank you again, everyone, for coming over to the podcast and sharing your experiences about the specialist examination, your expertise, and knowing what these specialties are. And I would also like to thank everyone who's watching. Earlier, PT Pinecast watched us, Jimmy McKay. And I also like to thank Mini. Yeah, she said certification opens doors of opportunity, especially board certification. And yeah, so again, so my takeaway as well is if this is something that triggers your your interest, piques your curiosity, and you feel that this is something that would work for you in your circumstance, then go for it, research. So again, thank you for everyone for watching PT Meal podcast, and watch out for our next episodes and our next handaan kung sino man yung magiging guest natin and our topic for that session. Thank you again everyone for watching.
Thank you, Johan. It's good to meet you guys.
Nice to have everyone here.
Bye.
Likewise,
Yeah.
it's been a great pleasure to be in company with this awesome, talented therapist.